historically, it was very underfunded. Do you know, one of the things that actually helped with that was a television programme. There was a weekly programme came out, a fictitious programme. It wasn't based on reality. It was all about the emergency ward within a hospital. Some of you might remember it. It was called Emergency Ward 10. And what that did is it increased the popularity of the emergency system within the general public, the awareness of it, if you like. So making it a nice place to work, or seemingly a nice place to work. She also mentioned about new models for service delivery as being required. Now, I have seen some of the hospitals around South Africa, and it goes without saying that some of the service delivery is, forgive me here, appalling. For instance, one of the things that I see regularly as I pop into various institutions is a patient who can't move themselves. And what happens? A nurse either side goes underneath the armpit and picks them up and starts carrying them around and putting them onto chairs or putting them onto beds or dragging them up a bed to get the head onto the pillow or whatever. You know, that's actually illegal to do in the UK. It's illegal for a nurse to physically pick a person up. How on earth do you move somebody if you can't physically pick them up and they can't move themselves? Well, we've got safer systems of work in place that allow us to do that. One petite 50-kilogram nurse can lift a 200-kilo man on her own using the equipment that we have in place. You might think that might be expensive to put all these systems of work in place. But how much are we saving? Not only on, how would you put a price on dignity, for instance? That's impossible. But what you can put a price on is things like the cost of diapers. We put a diaper on a person for the simple reason that they can't get themselves to the toilet. And our nurses can't physically carry them there. So they wear a diaper. How much are we spending on diapers in South Africa? If they're wearing diapers, they're going to get urinary tract infections. That's part and parcel of the whole thing. How much are we saving, or how much would we save on catheters, on antibiotics to treat these infections, if you just have the correct systems of work in place? Now, the UK were very slow in working this out, and they actually took 30 years almost to go from an initial realisation of this to where we are now, where nurses will be disciplined if they're seen picking somebody up physically. But as a result of that, our nurses are well looked after physically themselves. They're not going home tired at the end of the day because they're not physically lifting people up. You know, I often see South African nurses and I'll ask them, would you go back to South Africa to work? I'd love to. That is the standard response. I would love to, but I won't. I can't work. I can't physically work in that environment anymore. It's too much of a demanding job in South Africa. And they come to England to earn their pounds. That was their initial motivation to go to England. But when they got there, they realised they had to spend their pounds as well. So that didn't work out. The only reason that many of them won't come back is the systems of work that's here are too difficult. Now, we need to improve that within the South African system, and it's easy to do, and it's very cost effective to do. You will save thousands per patient because they're getting discharged from hospital earlier, and the whole system works. I'm aware of time, so I'll speed up.